Hello again, everybody. This is again Irina and Susan. We're here to bring you some AI information for our nurses. And today we'll tell you a little bit about what the prompts are and how to master the prompts. Susan, what is the prompt?
Yeah, a prompt is very simply, it's just instructions that you're giving to the AI tool. So whether you're using ChatGPT or an EHR or any kind of simulation tool, Copilot, any of those things, you're just giving it the specifics as to what you want the output or the outcome to be. So the issue here is, and we'll talk about the framework that we're going to use, but really sometimes is making sure that the instructions are very clear and that will provide you with the output that you're looking for.
Yeah, perfect. And let's go into the prompts using I guess I just want to say, like, yeah, prompts are almost like the order that when
Right.
as nurses we get order from the doctor that says, give 20 milligrams of Lasix right now, wait patient every hour for 5 hours. So the more specific the instructions
Yeah.
are, the better you'll understand. And imagine if
Yeah.
you're a nurse and you're getting an order and it says, give patient diuretic. You're like, which one? What's the dose? How much?
Right.
How long? So that's why it's important. And that's why you need to be really good at understanding how to use it. And today we'll use I guess, COSTAR framework.
Yeah.
Um, and Susan, if you don't
Yeah,
mind, tell us.
this is just a kind of a structure framework for nursing AI prompts. So context is obviously providing the background, whether it's a patient case, a setting, a learning objective, providing an objective. What is it that you want the AI to do? Do you want it to generate an Excel spreadsheet? Do you want it to analyze case studies? Whatever the objective is, it needs to be determined. Style is what kind of format do you want it in? Do you want it in a bulleted list? Do you want a chart, a case study, a dialogue? And tone. What is the tone? Is it professional? Is it student friendly? Is it clinical? Is it whimsical? That's one of my favorites.
Oh, I love that.
Um, and then again, who is the audience? What do you want the instructions to be? So who is going to use this? Is it going to be students? Is it going to be nurses? Is it going to be patients? Is it going to be colleagues? And then finally, role. What's the role of AI? So what basically it's what voice they're using. So in as the prompt would be, as a nurse educator, create blah blah blah. I'm a
Mhm.
clinical preceptor, blah blah blah, or a patient advocate.
Yep.
So that's really the nuts and bolts of the COSTAR framework.
And that's beautiful. And we'll give you an example. This is really using the COSTAR framework. This is what you would say, for example, if that's for you. As a nurse educator, so that's your role. That's the role that you're actually assigning to AI.
Correct.
Create a case study, which is style, because you can say create a table or create a
Right.
visual. So this is a case study in a professional but student-friendly tone. Because, by the way, if you don't say that, it's probably going to assume that it has to be very professional and it could be harsh. And I've seen them very
Correct.
harsh.
Yeah.
For junior BSN student, which is the audience, I would actually say go further, because when I'm creating something for my students, I say, my students are last semester of BSN. This is the class,
Yes.
with the name
Yeah.
that we have. So the more you give, the
Yes.
better AI understands.
Absolutely.
The objective is to help students identify priority nursing intervention for a patient with congestive heart failure. So that's your context. Like, what it is that you want AI to do? It's case study for CHF patient, for nursing student, so the nursing student can prioritize interventions. And the output is probably going to be something that's exactly what you wanted. And then AI will generate the structural case study with realistic patient data. Again, make sure, like as Susan always say, you have to validate. And you can't just copy and paste and send it, because as I said, sometimes AI hallucinates, and
Yeah.
a lot of times I go back and I say, no, no, this is more complex. Like
Right.
this is a junior student, not a
Yes.
senior student.
Yeah.
They haven't had that experience. So really need to go very deep into explaining who they are, what you want AI to be, and what it is that you're looking for. And talk about this next SBAR
Yeah, and
handoff.
so here is another example of using COSTAR in creating an SBAR handoff simulation. So here you are so you want the AI to assume the role of I'm a clinical preceptor, and you want to generate an SBAR handoff report, which is the style, in a concise, professional tone for a new graduate nurse. So this is somebody, maybe who's not so much in the educational setting, but in the work setting, who is, precepting or mentoring a new graduate nurse or a new nurse to the unit. The objective here would be to practice safe handoff communication for a patient admitted with community-acquired pneumonia. That's your context. And your desired output from the AI tool would be to include patient demographics, admission diagnosis, current vital signs, medications, and two priority nursing concerns. So now you have a really nice, realistic SPAR script that students or new nurses can use as a role play or a simulation exercise. And all this is done in a matter of minutes rather than hours. And again, always checking it for accuracy, relevancy, and making sure that it's free of biases. But certainly, our fun can be kind of a fun creating these type of exercises for our students and others.
Yeah, and maybe homework for you after watching this very short video is, comment and design this AI prompt for whatever it is you're doing, your nursing role, your nursing educator role, anything you just like. You want to find recipe for the best baguette, but
Yeah,
you
yeah.
have to say, like what is the role? If you're asking, give me the best baguette recipe, it could be very complicated because the best means like the most amount of time and whatever. Or if
Yes,
you'll say, give me the easiest, it could be something that even a 5-year-old can do. So where are
correct.
you in that equation? So really, if you can just think about anything you want and comment under this video and let us know what you used and how did you teach your AI platform to maybe become a little better. And so then you can feel much better using it and understanding what it is that you're trying to achieve. And again, we are here, Susan and I are here to help you and get to your goals. So
Yeah.
thank you so much,
Enjoy.
and
Share
please
your
enjoy
examples.
and stay tuned
Thanks.
for the next one.